Hello, I'm Dr. Shawnda Hollie, internist. The Benjamin Franklin quote, "An ounce of prevention is worth a pound of cure," has profound meaning when generalized to the medical field. But what is the worth of prevention when there is not yet a cure? When it comes to the current COVID-19 pandemic, the worth of prevention is priceless. That's why we're all doing our part to help slow the spread of COVID-19. We're washing our hands often, we're avoiding touching our faces, we're cleaning and disinfecting our frequently touched surfaces daily, and we're avoiding close contact with others, staying home as much as possible, and practicing social distancing. So what is the difference between social distancing, quarantine, and isolation? Social distancing requires keeping space between yourself and other people outside of your home. Stay at least 6 feet away from others and avoid gathering in groups. Quarantine is used to keep someone who possibly was exposed to COVID-19 away from others. While in self-quarantine, the individual stays separated from others and limits his or her movement outside his or her home. If you feel healthy, but recently were in contact with someone with COVID, you will be asked to self-quarantine and monitor for symptoms for 14 days. Isolation is used to separate sick people from those who are well. People who are in isolation should stay home and separate themselves from others by staying in a specific area of the home. If you're recently diagnosed with COVID-19, are awaiting results, or have cough, fever, or shortness of breath, you'll be asked to self-isolate away from others. I would like to offer a few additional tips suggested by the CDC for staying safe and preventing disease. First of all, stay informed. Get up-to-date information on the pandemic's effect on your local community. Get this information from your local public health officials. Prepare for possible illness. Consider those in your home and think of an area that can be used if isolation is required. Follow everyday preventive steps like washing hands to help prevent the spread of disease. Watch for symptoms and contact your health care provider with any questions. Limit close contact by only leaving home for essential needs. If you must visit stores for essential needs, practice social distancing. Wear a cloth face covering when in public. And when it comes to your medical needs, reach out to your primary care provider and see if they offer telemedicine visits. Also, use drive-in pharmacies or drive-through pharmacies, or get your medications sent to you via mail if possible. As we all do our part to slow the spread of COVID-19, also make sure that you take care of yourself. Continue to take your medications as prescribed. Avoid excessive alcohol use. Remain active while at home and make healthy food choices. Take care of others. Reach out to family, neighbors, friends while maintaining social distancing and assess their needs. And remember, not only is prevention priceless, but you are too. Stay safe.